Hey, what up? Welcome back. Today we're going to cover Chapter 21, Injuries to the Chest, Abdomen, and Genitalia. Let's get started. Many injuries to the chest and abdomen involve only soft tissues. Often these injuries, like those that occur elsewhere in the body, are only minor cuts, scrapes, burns, and bruises. Occasionally, a violent force or mechanism known as trauma results in more severe injuries. These include fractures and injuries to organs, which can cause severe bleeding and impair breathing. Occupants who are not wearing seatbelts during motor vehicle collisions often suffer fractures and lacerations. Falls, athletic injuries, and many other forms of trauma may also cause such injuries. Injuries to the pelvis may be minor soft tissue injuries or serious injuries to bone and internal structures. Because the chest, abdomen, and pelvis contain many organs important to life, injury to these areas can be fatal if left untreated. You may recall from a previous chapter that a force capable of causing severe injury in these areas may also cause injury to the spine. General care for these injuries include calling for more advanced medical personnel, limiting movement, monitoring breathing and other vital signs, controlling bleeding, and minimizing shock. The chest cavity, also called the thoracic cavity, is the second largest body cavity and contains the heart and lungs. The ribs, sternum, and upper portion of the spine frame the wall of the thoracic cavity, also referred to as the thoracic cage. The diaphragm, a large muscular partition, separates the thoracic cavity from the abdominal cavity. Below the diaphragm is the abdominal cavity. The abdominal cavity contains the major organs of several of the body's systems: the digestive system, urinary system, and endocrine system. The abdominal cavity is lined with a thick membrane called the peritoneum, which supports the organs, including the stomach, gallbladder, urinary bladder, intestines, liver, spleen, pancreas, and kidneys. It also contains important vascular structures such as the abdominal aorta and inferior vena cava. Genitalia are part of the reproductive systems of women and men. The male genitalia include the testicles, a duct system, and the penis. The female genitalia include the ovaries, fallopian tubes, uterus, and vagina. Chest injuries are the second leading cause of trauma deaths each year in the United States. About 35% of deaths from motor vehicle collisions involve chest injuries. Crushing forces, direct blows, and falls can also lead to such injuries. Chest wounds can either be open or closed. Open chest wounds occur when an object, such as a knife or bullet, penetrates the chest wall. Open chest wounds also can be caused by fractured ribs that break through the skin. A chest wound is considered closed if the skin is not broken. Closed chest wounds are generally caused by a blunt object. Certain types of chest injuries may be life-threatening, and others merely cause discomfort. You will likely be able to recognize severe injuries. It is important to summon more advanced medical personnel in those situations. Blunt trauma is injury caused by the force of an object that impacts with but does not penetrate the body. Signs and symptoms include shortness of breath, chest pain, and rapid, possibly irregular pulse. The possibility of blunt trauma should be considered in patients who sustain a blow to the abdomen or chest and show signs of respiratory distress. Often, associated injuries will occur with blunt trauma, including major trauma to the spleen or liver. Therefore, it's not unusual for patients with these injuries to go into hypovolemic shock, a type of shock in which there's multiple organ failure due to major fluid loss, usually blood. Traumatic asphyxia, or severe lack of oxygen due to trauma, can result from chest injury. These injuries are often caused by a strong crushing mechanism or by situations in which patients have been pinned under a very heavy object. Signs and symptoms of traumatic asphyxia include shock, distended neck veins, bluish discoloration of the head, tongue, lips, and neck and shoulders, broken blood vessels in the eyes, black eyes, pinpoint-sized red dots on the head and neck, rounded moon-like facial appearance, bleeding from the nose or ear, coughing up or vomiting blood, loss of consciousness, seizures, or blindness. Traumatic asphyxia is a very serious emergency that requires immediate intervention. If it is suspected, call for more advanced emergency medical services personnel immediately. Assess the patient for associated chest and abdominal injuries. Elevate the patient's head to approximately 30 degrees to decrease pressure to the head. Establish and maintain adequate airway and breathing, and administer emergency oxygen if needed. Rib fractures are usually caused by a forceful blow to the chest. Although painful, a simple rib fracture is rarely life-threatening. The patient will usually attempt to ease pain by leaning toward the side of the fracture and pressing a hand or arm over the injured area, thereby creating an anatomical splint. When ribs are broken, suspect the possibility of internal injuries. The first priority with broken ribs is adequate breathing. A patient with a fractured rib often has shallow breathing because normal or deep breathing is painful. Give the patient a blanket or pillow to hold against the fractured ribs. Use a sling and binder to hold the patient's arm against the injured side of the chest, and monitor breathing. Possible complications of broken ribs include collapse of a lung due to air in the chest cavity pressing on the lung, a pneumothorax, accumulation of blood between the lungs and the chest wall, a hemothorax, air in the tissues under the skin, subcutaneous emphysema, bruising or piercing of the lung and injuries to the spleen or liver, or lacerated blood vessels between the ribs. In situations involving severe blows or crushing injuries, multiple ribs can fracture in multiple places. These fractures can produce a loose section of ribs that does not move normally with the rest of the chest during breathing. Usually, the loose section will move in the opposite direction from the rest of the chest. This injury is called a flail chest, which is considered a serious rib fracture and can be life-threatening. When a flail chest involves the breastbone is separated from the rest of the ribs. In flail chest, the lung tissues may be bruised, leading to inadequate oxygenation of the heart. There is also a risk of the ribs puncturing a lung. If you suspect a fractured rib or ribs, have the patient rest in a position that will make breathing easier. Binding the patient's arm to the chest on the injured side will help support the injured area and make breathing more comfortable. You can use an object such as a pillow or rolled blanket to help support and immobilize the injured area. Serious fractures often cause severe bleeding and trouble breathing, and shock is likely to develop. Administer emergency oxygen if it's available, and continue to monitor the patient's vital signs. Pneumothorax is the collapse of the lung due to air in the chest cavity pressing on the lung and preventing it from expanding. Pneumothorax can occur in two ways. In blunt chest trauma, it may result when a fractured rib penetrates the lung, causing air to leak. It can also occur when air enters the chest cavity because of a sucking chest wound. Pneumothorax reduces lung pressure and leads to respiratory distress. Patients may report pain while breathing and pain at the site of rib fractures. Decreased breath sounds will be present upon examination, and many patients with traumatic pneumothorax also have some element of severe bleeding, causing a hemopneumothorax. Patients with pneumothorax will require a chest tube in order to fully re-expand the lung. Hemothorax is an accumulation of blood between the lungs and the chest wall in the pleural space, which creates pressure on the heart and lungs and prevents the lungs from expanding, resulting in the same symptoms as those which occur in a pneumothorax. The bleeding that leads to a hemothorax may be from the chest wall, the lung's functional tissue, the parenchyma, or major blood vessels in the thorax. It may occur following blunt or penetrating injury to the chest and often occurs together with pneumothorax. Again, patients will complain of pain and shortness of breath, and the condition may cause shock. During pain assessment, if trained to do so, you will likely note a decrease in breath sounds and dullness when tapping and listening to breath sounds using percussion over the affected area. A massive hemothorax will also cause abnormal or unstable blood pressure. A chest tube is required with the patient who has a hemothorax, and close monitoring of the initial and cumulative hourly chest tube drainage will help determine if there is a need for surgery. Tension pneumothorax is a serious life-threatening injury in which there is a complete collapse of the lung. Air enters the space around the lungs and remains trapped there. It is caused by the same traumas as those that produce a simple pneumothorax. Tension pneumothorax causes air to continue leaking from an underlying injury to the functional lung tissue, the pulmonary parenchymal injury, which increases pressure within the affected side of the chest cavity. Patients are typically in respiratory distress with reduced breath sounds or complete absence of breath sounds, and that side of the chest produces abnormal breath sounds during percussion. Because the trachea is shifted away from the side of the injury and the space between the lungs, contents are shifted away from the affected side, and decreased return of blood to the heart results. The patient will show signs of unstable blood pressure such as abnormally low blood pressure, hypotension, which can quickly develop into complete cardiovascular collapse. Extreme pressure in the chest cavity prevents blood from returning to the heart, and the blood is no longer pumped out. Death can occur quickly. Immediate care provided by advanced medical professionals for this life-threatening condition includes decompression of the affected lung by inserting a large bore needle through the second intercostal space along an imaginary line that passes through the midpoint of the clavicle. A chest tube is then inserted. You should know the signs and symptoms of serious chest injury. These may occur with both open and closed wounds, and they include shortness of breath and difficulty breathing, pain during breathing, pain at the site of the injury that increases with deep breathing or movement, obvious deformity such as that caused by a fracture, flushed, pale, ashen, or bluish discoloration of the skin, coughing up blood, distended neck veins, or a drop in blood pressure. Puncture wounds to the chest range from minor to life-threatening. A forceful puncture may penetrate the rib cage and allow air to enter the chest through the wound. This prevents the lungs from functioning normally. Puncture wounds cause varying degrees of internal or external bleeding. If the injury penetrates the rib cage, air can pass freely in and out of the chest cavity, and the patient cannot breathe normally. With each breath the patient takes, you may hear a sucking sound coming from the wound. This is the primary sign of a penetrating chest injury called a sucking chest wound. Without proper care, the patient's condition will worsen quickly. The affected lung or lungs will fail to function, and breathing will become more difficult. Your main concern is the breathing problem. To care for a sucking chest wound, cover the wound with an occlusive dressing, one that does not allow air to pass through it. Tape the dressing in place on all sides except for one side that should remain loose. Taping the dressing this way keeps air from entering the wound during inhalation, but allows it to escape during exhalation. If none of these materials is available, a folded cloth, or as a last resort your gloved hand, may be used. Administer emergency oxygen if it's available, and take steps to minimize shock. If no spinal injury is suspected, have the patient sit or lie in a comfortable position. An impaled object or embedded object is one that remains in an open wound. In the case of an impaled object in the chest, it is extremely important not to remove the object unless it interferes with chest compressions. Instead, the object must be stabilized to keep it from moving. This can be accomplished by using a bulky dressing or gauze around the object. This will also assist in controlling bleeding. Emergency care for an impaled object includes the following steps. Stabilize the object to prevent further damage. Remove clothing to expose the wound. Control bleeding by applying direct pressure to the edges of the wound, but avoid placing direct pressure on the object. Use a sterile, bulky dressing to help hold the object in place. Carefully pack the dressing around the object. Secure the sterile, bulky dressing in place with gauze, a cravat, or tape. The abdomen is the area immediately below the chest and above the pelvis. It is easily injured because it's not surrounded by bones, although it is protected at the back by the spine and ribs. The upper abdomen is only partially protected in front by the lower ribs. The muscles in the back and abdomen also help protect the internal organs, many of which are vital. Certain organs are easily injured or tend to bleed profusely when injured, such as the liver, spleen, and stomach. The liver is rich in blood. Located in the upper right quadrant of the abdomen, the lower ribs somewhat protect this organ. However, it is delicate and can be torn by blows from blunt objects or penetrated by a fractured rib. The resulting bleeding can be severe and quickly be fatal. The liver, when injured, can also leak bile into the abdomen, which can cause severe infection. The spleen is located in the upper left quadrant of the abdomen behind the stomach, and it's protected somewhat by the lower left ribs. Like the liver, the organ is easily damaged. The spleen may rupture when a blunt object strikes the abdomen forcefully. Since the spleen stores blood, a spleen injury can cause a severe loss of blood in a short time and can be life-threatening. The stomach is one of the main digestive organs. The upper part of the stomach changes shape depending on its contents, the stage of digestion, and the size and strength of the stomach muscles. Many blood vessels and nerves line the stomach. It can bleed severely when injured, and food contents may empty into the abdomen and possibly cause infection. Abdominal pain is common and often not serious. However, acute and severe abdominal pain, referred to as acute abdomen, is usually a symptom of intra-abdominal disease such as appendicitis or peritonitis. The signs and symptoms of serious abdominal injury include severe abdominal pain, bruising, external bleeding, nausea and vomiting, sometimes with the vomit containing blood, pale or ashen, cool, moist skin, weakness, thirst, pain, tenderness, or a tight, swollen feeling in the abdomen, organs possibly protruding from the abdomen. Several steps must be taken when assessing a patient with a potential abdominal injury. First, establish spinal stabilization if a spinal injury is suspected. Check the patient's position. Knees flexed toward the chest are a good indication the patient has suffered an abdominal injury. Inspect the abdomen for contusions, lacerations, abrasions, or punctures. Look for signs of potential internal bleeding, including a distended abdomen, as well as discoloration or bruising around the navel and sides. Inspect the patient for internal organs protruding from an open abdominal wound, such as an abdominal evisceration or disembowelment. Palpate the abdomen from the furthest point away from the pain, noting tenderness or masses. If the patient has a decreased mental status, it is important to note grimacing or signs of pain as you palpate. Keep in mind that the patient may be contracting stomach muscles to avoid pain, or the contractions may be the result of muscle spasms. Assess both the upper and lower extremities for injury and a pulse, as abdominal aortic injury may cause the pulses of the lower extremities to be weaker than the upper. If no foot pulses are found, check the pulses at the back of the knee or the thigh. These should be equal to or stronger than the radial pulse, even in cases of shock. Assess motor and sensory function. Log roll the patient and inspect for signs of trauma. Assess baseline vital signs, especially for indications of blood loss and shock. Symptoms such as low blood pressure, rapid heartbeat, or pale, cool, moist skin are all indications of shock. Ensure that the airway is open and the patient is able to breathe adequately. If inspection of the airway shows signs of bloody vomitus, suctioning may be required. If the patient is not breathing adequately, begin positive pressure ventilation with emergency oxygen. Like a chest injury, an injury to the abdomen is either open or closed. Even with a closed wound, the rupture of an organ can cause serious internal bleeding that can quickly result in shock. Injuries to the abdomen can be extremely painful. Serious reactions can occur if organs leak blood or other contents into the abdominal cavity. To care for a closed abdominal injury, carefully position the patient on their back. Avoid applying direct pressure. Bend the patient's knees slightly. Doing so allows the muscles of the abdomen to relax. Place rolled up blankets or pillows under the patient's knees. If moving the patient's legs causes pain, or you suspect spinal injury, then leave their legs straight. Administer emergency oxygen if it's available, take steps to minimize shock, and summon more advanced medical personnel. A severe open injury may result in evisceration, a situation in which abdominal organs protrude through the open wound. To care for an open wound in the abdomen, follow these steps. First, summon more advanced medical personnel. Carefully position the patient on their back. Avoid applying direct pressure. Avoid pushing the organs back in. Remove clothing from around the wound. Apply moist, warm tap water can be used, sterile or clean dressings loosely over the wound. Cover the dressings loosely with plastic wrap if available. Cover the dressings lightly with a folded towel to maintain warmth. Keep the patient from getting chilled or overheated, and administer emergency oxygen if it's available. If the patient has been impaled by an object in the abdomen, it is important not to remove the object. Instead, dress the wound around the object to control the bleeding. Stabilize the object with bulky dressings to prevent movement. There are multiple causes of gastrointestinal bleeding, and these tend to be classified as either upper or lower, depending on the location of the problem within the gastrointestinal tract. Bleeding in the upper gastrointestinal tract originates in the esophagus, stomach, or duodenum, which is the first part of the intestine, and may include such problems as peptic ulcers, gastritis, stomach cancer, or ingestion of caustic poisons. Bleeding in the lower gastrointestinal tract originates in the small intestine, large intestine, rectum, or anus, and includes diverticular disease, polyps, hemorrhoids, and anal fissures, as well as cancer and inflammatory bowel disease. A patient with gastrointestinal bleeding may experience vomiting of blood, bloody bowel movements, or black tarry stools. Symptoms that may accompany the bleeding include fatigue, weakness, abdominal pain, pale appearance, and shortness of breath. Serious gastrointestinal bleeding can have a significant impact on vital signs, for example, causing blood pressure to drop sharply and their heart rate to increase. Summon more advanced medical personnel, as the patient may require blood transfusion or surgery. Assessing and treating a patient with a genital injury requires a calm and professional approach. as it can be embarrassing not only for the patient, but also for you. Using a sensitive approach to the patient's situation, such as clearing onlookers from the scene, supplying a drape for privacy, and reassuring the patient, will help the process be less embarrassing. If possible, someone of the same gender should treat the patient. Injuries to the penis usually occur as a result of an accident or assault. They can be either closed wounds such as a bruise, or open wounds such as an avulsion or laceration. Regardless, genital injuries are extremely painful. The female organs, like those of a male, can cause extreme pain when injured. However, these types of injuries are rare, as the female genitals are smaller and much more protected. Straddle injury and sexual assault are the most common injuries in which female genitals can be injured, as well as childbirth. Injuries can cause severe bleeding and pain due to the large amount of blood vessels in the area. Despite excessive bleeding, these injuries are rarely life-threatening. Signs and symptoms of genital injury are similar to those for an abdominal injury. They include severe pain, bruising, external bleeding, nausea, vomiting sometimes containing blood, weakness, thirst, pain, tenderness, or a tight feeling in the area, protruding organs, rigid abdominal muscles, or other signs of shock. Care for a closed wound to the male genitals as you would for any closed wound. Wrap the penis in a soft, sterile dressing moistened with saline solution and apply a cold compress to reduce pain and swelling. As with any injury, never remove an impaled object. Stabilize the object and bandage it in place for transport. If the injury is an open wound, apply a sterile dressing and direct pressure with your gloved hand or the patient's hand, or use a protective barrier to avoid contact. In the case where the penis is partially or completely amputated, apply a sterile pressure dressing to help stop bleeding, which may be significant. Aggressive direct pressure may also be needed if bleeding is excessive. As with an avulsion, if the penis is found, follow the procedure for preserving and transporting parts. If any parts are avulsed or completely amputated, wrap them in sterile gauze, moistened in sterile saline if available. Then place them in a plastic bag, labeled with the patient's name and the time and date that they were placed in the bag. Keep the bag cool by placing it in a larger bag or a container of ice and water slurry, but not on ice alone and not on dry ice. Transfer the bag to EMS personnel transporting the patient to the hospital. It's also possible for injuries to affect the scrotum and testicles. A blow to this area can rupture the scrotum and cause pooling of blood, which is extremely painful. A ruptured testicle requires surgery. Apply an ice pack to the area to reduce swelling and pain, and if the scrotal skin has become avulsed, try to find it. Wrap the skin in sterile dressing and transport with the patient. The scrotum should be dressed with gauze sterilized and moistened with saline. Apply pressure to control bleeding. To provide care for an injury to female genitals, control bleeding with pressure using compresses moistened with saline. Use a diaper-like dressing for the wound, and stabilize any impaled objects with a bandage. Use ice packs over the dressing to reduce swelling and ease pain. Never place anything in the vagina, including dressing. Treat the patient for shock as required. Remember your training regarding a crime scene if you suspect a patient has been a victim of a sexual assault. Take care to provide the patient with privacy by clearing the area of onlookers and draping a sheet or a blanket over the patient. Do not touch the genitals. Discreetly ask if the patient has suffered any other injuries, such as to the head. If bleeding is life-threatening, this will take priority over maintaining the integrity of the crime scene. Do not allow the patient to bathe or douche, and discourage the patient from washing the hair or cleaning under the fingernails. Unless injuries are life-threatening, do not clean or touch any wounds. Handle the patient's clothing as little as possible, bagging them separately from any other items. If there is blood on the items, do not use plastic bags, and be sure to follow local protocols. Injuries to the chest, abdomen, or genitalia can be serious. They can damage soft tissues, bones, and internal organs. Although many injuries are immediately obvious, some may be detected only as the patient's conditions worsen over time. Watch for signs and symptoms of serious injuries that require immediate medical attention. Care for any life-threatening condition, and then give any additional care needed for specific injuries. Always call for more advanced medical personnel as soon as possible. Have the patient remain as still as possible. For open wounds to the chest, abdomen, or genitalia, control bleeding. If you suspect a fracture, immobilize the injured part. Use occlusive dressings for sucking chest wounds and for open abdominal wounds when these materials are available. Your actions can make the difference in the patient's chances for survival. So that does it for all the injuries to the trunk. If you guys have any questions for Chapter 21, be sure to leave a message or submit a comment. Thank you so much for all your hard work and dedication. That's gonna be it. Until next time, everyone, be good people, do good things, and I'll see y'all later. Bye.